So now I would like to turn it over to Dr. Rachel Grashow, who is the Director of Epidemiological Research Initiatives at the Football Players Health Study, to get us started.
Hi, can everybody see my presentation? Okay. So I'm just going to briefly introduce sort of a little scientific summary to set us off while we talk about former NFL players' hearts and health. So just an overview on the Football Players Health Study. It is the largest study of living former players, with 4,200 former players who have filled out some surveys for us. Some have come back and said more, and 110 who came to us in Boston for a 3-day full body assessment. I'm proud to say that our cohort is diverse by age, race, and position, and that we study not just lifespan, which is length of life in former players, but also their health span, the number of years lived without disease, without pain, and without disability. We have an emphasis in all the work that we do to look at health equity, race, and discrimination and racism. And our objectives, our research objectives, are player and family driven. The community-based participatory research we approach, that feedback guides what we look at scientifically. And the whole point of doing this is because we want to find established, safe, and effective interventions for players to help increase their lifespan and their health span. So I'm going to talk really briefly about the way that player health is conceived of and how we're trying to shift it. So currently there's a preconceived notion that professional football, and this involves head injury among other things, changes the brain and mental health. And then over time, this leads to changes in cognitive dysfunction and function over time, issues with memory and thinking and concentration. And you'll see, you probably recognize in this narrative, really the CTE story. And what the conversation revolves around is that CTE is pervasive, everyone has it. It's permanent, there's no treatment, there's no cure. And it's progressive in that it'll just get worse. But what we feel has been largely not studied or understudied is cardiovascular health in former players. And what's not really appreciated is that actually 65% of players pass away from cardiovascular disease, which is 4 times as many as pass away from neurodegenerative. And we think this number is really striking and offers us a way to intervene and study players more. And so what's exciting about looking at how football play and head injury affects the heart and vascular health and how this affects long-term heart health is that unlike this sort of gray pathway, there's medicine, there's lifestyle changes, there's dietary changes. There's so much that we can do to intervene on this pathway since it affects players' lives to such a great degree. And one thing that's appreciated in medicine, and I'll turn to the cardiologists on the call too for this, is that the heart and the brain are actually very closely linked. And when the heart isn't doing well, the brain doesn't do well. And so what's exciting to us is that if we can actually have some positive intervention here, we can actually improve in someone's life, their memory, their thinking, their concentration in a way, as we also protect their health by going after things like hypertension. And as we start to understand hypertension, one of the things that we found in our study is that the head injury that players experience is linked to hypertension after they leave the league. And we find this to be most striking in our youngest players, the ones who have just left. And so again, this is an opportunity, if we can raise awareness and talk about it, for the chance to protect the heart and the brain long-term by talking about hypertension after players leave. So this is obviously overwhelming. I put this slide up to say that this is how the Football Players Health Study sees player health. It is complicated, is interconnected in some ways very good ways. And what we look at is we look at the childhood of players and how those factors impact health. We look at how that impacts how their experiences playing, whether it's head injury or position or painkillers or other things. We look at how professional football experiences impact lots of aspects of health. So that's the brain and mental health for sure, but also testosterone and hormonal health, the heart and vascular health, sleep quality, and also musculoskeletal and joint health. Because we're looking at cognitive health, heart health, and chronic pain and disability in the long term. And I'll say that one of the pieces I'm most proud of our study, which I think will come up today as well, is the way that social determinants of health, which are factors that are impactful across the entire lifespan, play into player health. These things are like socioeconomic status and income, having health insurance, experiences with racism and discrimination, exercise, financial security. All of these pieces also impact health. So that's a key piece of what we look at and will come up today. And what I want to say too is that while that slide is overwhelming because everything is so interconnected, there's a positive side to that as well, which is that, for example, if we can improve sleep in players, we have the chance to improve brain function and thinking. We have the chance to improve the heart and also to combat some of the chronic pain and disability that players experience. So we want to go after all these things. Today, we're going to talk about cardiovascular health and hypertension and how that impacts the heart and the brain. It is such an absolute honor to introduce our moderators, Holly Robinson Peete and Rodney Peete, who do and put so much good into the world. And one of the tiny ways they do that is through their work as a family and a player advisor with us. So I'm going to turn it over to them and stop sharing my screen. So thank you all for listening.
Well, good morning, everyone. I guess, yeah, even on the East Coast. Well, it's afternoon. So excited to be part of this. Rodney and I came on to the player study many years ago, the very first year, and we took a trip to Harvard, and we really were so excited to see something like this organization, this amazing university, talking about something no one else was talking about, and really putting so much into it. We felt seen, we felt heard, we felt understood, we felt like somebody was really cared about this issue that in all fairness, we felt the NFL was ignoring. And so we are very happy to be here, fresh off the Super Bowl, to talk to everyone here about heart health. As you know, February is Heart Health Month. This is something that affects everybody we know. No one is not affected by it. And don't worry, Rodney, I will let you talk. I will let you get a word because I can already see him.
No. Listen, you are the quarterback of our family. I'll put it that way.
Okay. Okay. Oh my goodness.
I'm not ashamed to say it. I'm not ashamed to say it. But as Holly mentioned, we're very excited to be a part of this study. We've been a part of it for many years now. It's crazy. I've been retired now for 20 years, coming up on 20 years, and it's time goes so fast. And after playing 16 years in the league, that time went so fast as well. But here we are 20 years later after being retired. And, I'm in that age bracket where you've really got to pay attention to what's happening around you, pay attention to your body. And I think one of the goals of this study and one of the goals of why we are here today is to really try to eliminate that stigma around health, especially former players' health. I can speak firsthand that I am one of those guys that hated to go to the doctor. I didn't really want to know. I just wanted to just get me fixed up so I can go back on the field. And once you retire, that mentality does not leave you. You still feel that way. It's like, I feel okay. So why do I need to go to the doctor? Well, you do, because there are certain things that are preventative that you can do if you are getting checked on a regular basis. So hear me when I tell you that. I've got a great support system in my wife who is making sure that I do get myself checked out. And it's so important. So we're both excited to moderate this thing and to be a part of this. I have questions. I'm sure Holly's got questions, and it's really an open discussion about heart health and how we can do better and how we can inform everyone about some steps that you can take to help your quality of life.
Yes. And so I think what we're going to do is just jump right into it with our questions and get going. And just another reminder, it's just never, ever, ever too early or never too late to take care of your heart health. We're going to talk about blood pressure. I mean, that's one of, let me tell you something, Rodney and I are always talking about blood pressure. and we have our monitors. We take them everywhere. We take the blood pressure all the time. Blood pressure management can look like, not just medication, but also, as we know, dietary and lifestyle changes and home monitoring, as we discussed, and many more. And what I've learned from being a part of this amazing study is that hypertension can cause, I didn't know this, memory, thinking, or concentration problems, which also might be misattributed to CTE. So let's jump right in. I would love everyone on the panel to introduce themselves so that we all know who you are. Many of you are familiar to us already, but so let's go counter or clockwise, and let's start with Herman Taylor. Herman, hi, how are you? And who are you? Tell everybody who you are.
Thank you very much, Holly. Greetings, everybody. I'm Herman Taylor. I'm a cardiologist, and I'm an adjunct professor at Harvard School of Public Health, but my principal appointment is here at Morehouse School of Medicine, where we focus on cardiovascular research in the institute that I lead.
Terrific. And now let's go to Meagan. How you doing this morning?
Good morning. So happy to be here. I'm Meagan Wasfy. I'm a sports cardiologist at the Mass General Hospital. That means my practice is all athletes or former athletes. And I'm one of the investigators with the Football Players Health Study, focus on the in-person assessments we did, as well as upcoming projects we have specifically addressing blood pressure.
Awesome. Thank you, Meagan. And now let's go to our girl, Telisa. How are you, Telisa?
Good morning, and thank you all for having me. My name is Dr. Telisa Spikes. I'm a cardiovascular nurse researcher at Emory University. And so I come with two hats as a player's sister, but also former player sister, and also a researcher that focuses on hypertension and aging.
So I think one of the coolest things about this study is that we're not just wives, we are sisters, we're mothers, we're loved ones, and the inclusion of the family is what I love so much about Harvard Player Study. If you're joining us, and we have a nice little group of people on here, and you're interested in joining the study, please come on board. We would love to have you. I learned so much. I'm one of those people that thinks I know everything already, and I have learned so much about so many things. But this particular conversation about heart health, let's discuss this. Rachel pointed out about sort of a little bit about the state of the science around heart health and former players. And anyone can answer this, but why is this important for family members and former players? And what can players and family members do starting today to take care of their heart health? Anyone who wants that can jump on in.
Okay, well, I guess I'll get us going. First of all, you're so right. The family is such an important unit where so much begins and so much can be confronted and dealt with. People talk about, I get a lot of questions about the genetics of hypertension or high blood pressure, and does it pass on through your genes? And certainly there's a genetic component to it, but you don't only pass on genes in families, you pass on traditions, you pass on food habits, you pass on attitudes towards healthcare access and when it's time to go see a doctor. And those things can be very important in affecting your blood pressure and other health issues. So the family is an important place to start. I would say, and everybody will have something to say about this, so I won't talk too long, but I think we can begin to just hold each other accountable, if you will, for attending to some of the things that are already proven to help with things like blood pressure and heart disease. There's one simple cluster of things that the American Heart Association is now calling the Life's Essential 8. They used to refer to the Life's Simple 7, but they include things like exercise, things you'd expect, exercise, diet, weight control, knowing your numbers, blood pressure, cholesterol, blood sugar, etc. They had 7 that they focused on, and of course, no smoking. Let me be sure to say that. They had 7 they used to focus on. Now the 8th one that the evidence was so compelling that we needed to pay attention to has been added, and that's sleep. And paying attention to your sleep habits, or as doctors like to say, sleep hygiene, becomes really important, along with all those other things that perhaps are more familiar and more frequently mentioned. So I would say, to the extent that family can begin to influence any of those 8 things, the family is critical. And of course, the family, familial support, you can't put a price on that. And that is also a critical part of the equation.
Mm-hmm. Anybody else want to join in on that? If not, just Rodney, you can jump in with another question if you have one.
I just add that, as Rachel outlined, heart disease is a common cause of health problems, a threat to longevity and quality of life in former players. But as it is Heart Health Month and you go red for women, it's also a threat to their partners and spouses, right? And so the family being in it together stands to improve the health of the whole family, I think, in that regard. And as Herman outlined, there is so much we can do in 2024 between understanding the lifestyle factors that are a threat to heart health, as well as things that we can do with medications if someone's really doing all they can with lifestyle factors to improve cardiovascular risk. As I mentioned in my practice, and this, Rodney, what you said resonated, right? I see all athletes are former athletes. So when I walk out to the waiting room to find them, they're easy to spot, right, amongst the other cardiology patients, because they're often the most vibrant, fit appearing people in the room, along with their family. And I think from the clinician end, it's important we don't let that appearance of health bias us in how we evaluate heart health risk. A life being highly active in sport and beyond benefits health, right? Exercise is medicine. But athletes and former athletes are really not immune from heart disease. And I worry sometimes the appearance of health leads to undertreatment of heart disease risk factors, let that blood pressure or cholesterol slide a bit. So we need to be careful not to do this. And, as Herman outlined, whether it's bad luck, bad genes, or other things, individuals who, despite great lifestyle, will still have risk factors that sometimes stick out. And it's important we get those managed appropriately.
Yeah. That is so well said. And sticking with what you were talking about, when you talk about the heart, sometimes it's so scary, right? When you think about it, especially as you get older, what can I do? It runs in my family. I'm predisposed to heart conditions, hypertension, high blood pressure, all these things. And sometimes as a former player, it gets overwhelming to the point where I don't do anything. I become stagnant. I become stationary. So what would be the advice for someone to start really and being specific about their heart health? Is it screenings? Is it really paying attention to your high blood pressure? Where do you start if you're someone that, look, I want to take control of my heart health?
That's a great question. And even beyond athletes, I even get that question from non-athletes, women as well. And one thing from a cultural perspective, I find amongst African Americans, we often say, well, my father, my mother had high blood pressure, or, my grandmother had high blood pressure, my grandfather had diabetes, so I know I'm gonna get it. Or it's just this misconception that well, all Black people are told they're going to get high blood pressure at some point. So it's inevitable. And that's, in fact, not true. Studies have come out maybe in the last 10 years or so that have said that genetics actually account for less than 25% of getting high blood pressure. So that says we actually hold the power in our hands to make these lifestyle modifications to mitigate or decrease our risk of developing high blood pressure. And studies have also shown that children as young as in the adolescent phases of life are showing signs of elevated blood pressure. So that goes back to what we just spoke about, the family unit. How does the family play a role modeling these health behaviors? How are we preparing meals? So with that being said, we do hold the power to decrease our risk by knowing our numbers. As Holly and you both mentioned that you all home blood pressure monitoring. So that's something that I think everyone should have, because you should know your numbers and have these conversations with your healthcare provider, in addition to understanding what are your risk factors when you are making those lifestyle changes, or what are those necessary lifestyle changes that needs to be implemented to decrease the risk. I'll just say, for instance, when people hear you need to exercise at least 30 minutes a day, that sounds very intimidating for people who are not accustomed to exercising. So what does that mean? It can be practical things as for those who are privileged to work at home, or maybe not. Be intentional with your walking. You can do that in the house, maybe at work, but just moving. It doesn't mean you need to go and break the bank to go pay for an expensive gym membership. So, I will say from that end, we do hold more power to control our risk than we know.
And
Yeah.
Telisa, if I could just say also that was beautifully summarized. I think that overwhelming nature of, when I say essential 8, does that mean I got to run out and do 8 new things to be healthy? Absolutely not. I would say, this is my personal priority, if I would start with, if you are a smoker, that's priority 1, to try to stop that. But after that, actually very close second, if you would pay attention to your blood pressure, that is so essential. It's possibly the leading cause of all of the heart conditions that we're concerned about. It contributes to just about every heart condition you can name. And I would say that would be a top priority. But what I want to say real briefly is that don't be overwhelmed. Don't necessarily try to do 8 things all together. Start somewhere. Pick 1 or 2 to really focus on to begin with. Measure your gains, see yourself improve, and it'll give you confidence to move to other aspects of this essential 8, or however you want to enumerate the things that are helpful for your heart. But don't be overwhelmed. Start somewhere. Start where you are. Don't try to dramatically change things over the month of February.
Although February is a good month to start.
It's a great month to start.
Let's talk about screening. Let's talk about cholesterol, and specifically, what cholesterol level should make you worry? What would you say? I feel like I have a decent IQ when it comes to BP and those numbers, but I really don't understand cholesterol levels. So what cholesterol level should make you worry? And then also maybe follow that up with heart checkups. What tests should we be having at what age should we have them? Anybody who wants to jump in on that.
Well, I think if we take those essential 8, some of those are things, your doctor can ask you about, like how much are you exercising? What does your diet look like? But ultimately are things that as a human, you're able to look and read and educate yourself about as well. But there are certain things, tests that, you're alluding to, things like cholesterol, measurement of blood pressure, things like your blood sugars that, optimally are monitored and checked on in concert with your doctor. And, these are lab checks or office measurements to start. And then, as Telisa mentioned, very powerful to follow up that, maybe 1 check of blood pressure in the office with measurements at home, because the body cares about the average, not that one moment in time in the office. From there, other tests to assess the status of someone's heart health and help in decision-making, either about lifestyle factors that, should be the key focus, or medications, for example, for blood pressure, cholesterol. Those are going to vary, right, and be very personalized. There's not a one size fits all. And actually, to point out a quirky thing, as you mentioned, when we think of a good blood pressure, that's actually pretty invariant. From teenage years up to when people are older, the same numbers apply, right? Our goal blood pressure is less than 130, that's the over, and less than 80, which is the under. And that just doesn't change across a broad swath of the lifespan. Cholesterol is an interesting one, and that the levels we might aim for someone that's had a prior heart event are about half of what we might give a pass to for someone who's just looking at that number, from like a preventative perspective. So that's a lot more customized, and something that, you need to have your numbers in front of you and work on those with your physician in a personalized way to know what sort of a good number for you should be aiming for.
Very good. Yeah, context matters, right? When it comes to some of these numbers, and whether or not that's your only issue, versus it being part of a cluster. And very often these risk factors, cholesterol, blood pressure, blood sugar, those elements being out of control actually happens in clusters, right? For a lot of people. So it really does get to be an individualized approach between you and your doctor, combining lifestyle adjustments as well as, in many instances, medications.
What I love about the study is that we address the entire body and how the entire body is related. And when you're talking about the heart, it's such an important, should I say muscle? Muscle, right? It's an important muscle in the body, and it affects so many things. And as you mentioned, Herman, that you could be doing a lot of things right, but if you don't address one aspect of your life or an important aspect of your life, then it could still throw things out of whack. And when you mention sleep, it's such a big deal. I don't think people understand the importance of sleep, and they put it low on the priority list because it's sleep. I can get on and do my day with 4 hours of sleep. I don't really need a whole lot of sleep to function during a regular day. But talk again about how important sleep is to your overall health, and in particular your heart health as well.
Certainly, and I invite the other members of the panel to chime in. Now, I'm not a sleep expert, but I'll tell you what I do know. It is critically important for people to get, people in our age range, to get 7 to 9 hours of sleep a night. Okay, that sounds like a hard and fast rule, but I will say as a target, it's a good set of numbers to keep in mind. Also, it's really critically important for people to begin to look at what's called the sleep hygiene. And one of the most important aspects of sleep hygiene is having a good time to go to bed, a consistent time that you actually begin to wind down and then have lights out in order to get that 7 to 9 hours before you wake up again and start the next day. Problems like sleep apnea are unfortunately fairly rampant in the ranks of former football players. Sleep apnea, as you know, is that obstructive sleep apnea is that disorder where your sleep gets interrupted by these periods where you stop breathing at night. And it's often characterized by loud snoring and partners who complain a lot about the fact that you sound like a buzzsaw at night, or various other descriptions. But it's not just a thing of making noise, right? When you have an obstructive episode, however brief at night, a whole lot of things happen along with that. There's a sympathetic discharge that happens often, and everybody knows the fight or flight response as the sympathetic response, the term that doctors use. That causes your blood pressure to rise. That causes your heart rate to go up. That causes all sorts of things physiologically in the middle of the night. And that can happen many, many times for people who have the sleep disorder or obstructive sleep apnea. Add it all up, if you took a group of people who come to a sleep center to have their sleep problem evaluated, over half of them have high blood pressure. And if you flip that over, if you just look at a group of people with high blood pressure, 30 to 40% of them have sleep apnea. The two are very tightly linked and can complicate one another. And often hypertension can't be effectively treated as long as a person is suffering from sleep apnea that is untreated. So I think it's very important. Again, family is important here too. If family members, bed partners are telling you that you're snoring like a freight train, that is an important signal for action, because that can impact your blood pressure. It can also impact your blood sugar and other elements of your overall health, particularly related to your heart health. And again, as Rachel said in her opening comments, which goes back to potentially impact your brain health, which is often a focus of football players after they retire.
As a mom, I just want to, as a bed partner, I just like to chime in here.
Go ahead.
So, listen, I'm going to take this opportunity to say, not just to my husband, but to all the husbands and wives out there, because we can get sleep apnea too, right? When we're poking at you and waking you up, it's not, as the doctor so eloquently put it, because we're like, oh, you're making so much noise. A, you're interrupting my sleep. I'm trying to get my 7 to 9 hours. And B, it's indicative of a bigger issue. And everybody needs to go get checked at a sleep center. I feel like everyone should just at least make that appointment to see if they have sleep apnea, because there is just regular snoring, and then there's sleep apnea. There's the stopping of the breathing, which impacts the heart and the brain and all the things. So when we are poking on you, and when some of us have even had to record you in the night to have receipts in the morning to let you know that you are really not breathing all the way through. And it's a serious issue, right? We joke, we laugh about it, but it's a very serious issue. And quite honestly, we've lost some friends, some NFL friends, to this very issue. So I just think that the awareness that we need to put out there is not just an aesthetics thing, or, oh, I don't snore. Yes, you do. You don't know, you don't. Get that checked. Go to get a sleep study, find out if you have sleep apnea. Everybody hates a CPAP machine. Everybody hates the idea of having to do that. But at the end of the day, these can be life-saving situations, and as it pertains to the heart, which we're talking about today. So it really wasn't my turn to talk, but
very well said, Holly. Very well said.
Y'all heard that, right? Are we recording this, Rachel? Y'all heard that. Actually, it was. I think we definitely have covered sleep. And I know Rodney said there are some questions. I want to make sure that we get to some of the questions that are in here. I see one that says, I visit my doctor every 6 months. Are there at-home tests, monitors, cholesterol, BP that you can recommend? And how often should testing, monitoring be conducted? So there's one question. Meagan,
Telisa had mentioned, you can take it for blood pressure now, and this is really true over the last 10 years. There's relatively inexpensive automatic blood pressure cuffs. Usually upper arm cuffs are better if you can find one that fits your arm, that you can know your numbers. And that is, oftentimes as physicians, we're seeing a patient for that half hour in the office once or twice a year. And sometimes the blood pressure is up in that setting. I don't wear a white coat most often, but it was sort of white coat pattern where just by being in the doctor's office, that blood pressure is up a bit because you're nervous about the blood pressure being checked, right? So that's where home monitoring, I give that out as homework when that happens, but it doesn't need to be that your measurement's high in the office for you to understand your numbers at home. And then it's it's a beautiful day in clinic when a patient brings, 2 weeks of measurements into that yearly office visit, because then the body does not care what the blood pressure is when you're sitting, on the exam room table. It cares what the average is. It's important if you're checking at home to do it right. It's after 5 minutes of quiet rest, seated in a chair with your feet on the ground and your back well supported. If you always do it right after your lovely workout, when you're in that endorphin lovely feeling phase, that's a little bit of cheating because blood pressure will be lower for a period of time after exercise. But any time of day works. Cholesterol is one of those ones where, you know, in general, unless there's some big change in lifestyle or something like that, that you're in general fine with checking that about once a year, which could then be with your doctor's office rather than the in-betweens.
Can I just go back real quick? Can you run through when you're taking it at home? You said seated, because sometimes I'll take it lying down. You said seated with your feet on the ground, not like your feet crossed and sitting in a. Can you just run those through again?
Oh, sure. If I was in clinic, I'd show you, but it's hard to get the right angle here. So yeah, 5 minutes of quiet rest. Who has time for that? But I mean, you can look on your phone. It's just to say, don't like run into your kitchen, sit down at the table and take it as your kids are yelling at you still or something like that. So 5 minutes of quiet rest, seated in a chair where your feet are on the ground and your back supported. This chair is actually pretty good for that. Basically as few muscles contracting as possible. And then the thing I didn't say is arm up at heart level. So I'm going to put my little higher, you know, in general up on a high table or a high counter. So that cuff is literally sort of at the level of your heart. And that's how you get sort of the most standardized measurement. I tell my patients any time of day, if they're making a log for me, for example, over 2 weeks, actually doing some in the morning and some in the afternoon makes sense. Because like I said, your body cares about the average. We also don't want people to get into the habit, though, of doing this too much, right? There is definitely, you know, your body cares about the average. But for example, if you're going to bring that into your doctor's office once a day, you know, over a 2-week period, so you have 10 to, you know, 12 to 14 measurements to average out is plenty to get a sense for, you know, what range your blood pressure is running in.
Yeah, and you can also, you know, how accurate, I should say, is Google for when you get the number and you put it into like your Google search. I feel like it was pretty accurate. There's obviously a range. And then some of the monitors will give you a green or red light and say high or low on the different numbers. So, but I think sometimes I'll take my blood pressure and then I'll take it again in 10 minutes and it's a little bit different, sometimes really different. So those are some things that I think are interesting when blood pressure is very finicky, it seems like, you know, very finicky.
Yeah.
It's taking in all these things from your body at once, right? Whether you've just exercised, what you've ate or drank over the past day, how stressed you are at that moment, and whether 5 minutes of quiet rest is enough to get you rested or you need another 10 minutes. And again, when someone gets an individual high value, it's important to emphasize that the body cares about the average. So it's good the cuffs will color code it, but when we as doctors look at a list, we're really either we're doing out a numerical average or in our brain doing out an average to see if that rises above what would be optimal, which is that 130/80 cut point. Even then, you know, the first line therapies would be any lifestyle tweaks or interventions. And I just want to dovetail off of what Herman said, which is to say, you know, there is a lot. There's what everyone can do, exercise, tweaks to diet, keep weight in a good range. I think specific to the former player population, though we also think about this in everyone, is sleep apnea because we see more of it. And then other drivers, right? So pain and stress, I think, are also unique factors. And we shouldn't, though they're not part of the essential 8 per se, I think they do influence all aspects of our health. And thinking of ways, you know, if the end goal is to control the blood pressure, great. But I think reducing stress and pain is important in and of itself as well.
Yes, and I was going to actually mention that. I think it was Rodney who said, even if you do all of these things right and you're still having issues, you know, what is the point? And pain is one of those factors that in this population is often not addressed. I wouldn't say it's not addressed, but it's not spoken of. And when someone is in chronic pain, as Dr. Taylor said earlier, it does elicit a physiologic stress response to the body, just as it would if someone is under psychosocial stress, maybe stress related to finances or health insurance. So that type of stress would elicit the same impact on the body as being in pain. So even if you're eating right, you're exercising, you're sleeping, you're still in pain, that can still cancel out the health benefits of those health protective factors that would quote unquote, decrease your risk for developing hypertension and all these other things. So making sure that it's a comprehensive assessment, that not only are we addressing these life essential 8 issues, but also pain and stress, the presence or maybe lack thereof.
Telisa, that's such a great point. Because when you, especially us, we have, you know, from playing, we have issues that we've dealt with and deal with when we retire. You know, the surgeries that we may have, and that we, you know, we have that pain. And I do specifically remember, you know, retiring and yet having had several knee surgeries that eventually became bone on bone, and I was just dealing with it, right? I didn't really address it until Holly, again with the videotape, showed me a video of me walking from behind, and literally I was walking as if I was in a Western in 1930, because my knees were bowed out like a cowboy that rode a horse for 24 hours straight. But it was also pain, right? That I just had learned to deal with. And then eventually I did have my knee replaced. And what that did, it just changed so much in my life and just my overall being as I woke up in the morning, not having to spend 30, 45 minutes kind of warming my knee up or getting ready or just waking up in a bad mood because I had this knee issue. I wake up now and I don't have that issue to deal with. And my overall mood to start my day is so much different. So dealing with those chronic pain issues is so important.
And we didn't even know at the time, because if we had, I'd have brought another kind of receipt. We didn't even know that that had any connection to the heart. You see what I'm saying? So this is all new information for so many of us who are participating in this webinar right now. We're learning new things as we're hearing these connection and the connectivity from stress of pain, as you just spoke of, to what happens to your heart. And so this is just great. I just want to just stop and reset and thank everybody for joining us. I think we have, how much more time do we have, Rachel? I just want to, where are we on time?
We have about 10 more minutes. So I think if there are a couple more questions, I think one of the things that I would love for our panel to just quickly go back to is to talk a little more about the cholesterol piece. I think, you know, we covered blood pressure a lot and there's so much to say about it, but I know for me personally, when I go to the doctors and they're throwing out all these numbers of HDL and, you know, the cholesterol ratio and all these things, it's a little hard for me to understand. And so I'd love for our cardiologists on the panel and clinicians to really break down, you know, what do these numbers mean? What can I ask my doctor for? And, you know, if I see a certain number ratio, you know, when do I sound the alarm?
My favorite sports analogy here is the total cholesterol is a useless number. Here in Boston, I usually say it's like saying the Red Sox played the Yankees and the score was 200, but I should have adjusted that for our football audience here. But it really is a useless number if I could just take because a lot of people remember 200 for that because it's nice and round, but it just, I wish I could delete it out. Because it is adding up cholesterol that we overall, cholesterol floating around our blood, one form of it goes around through our arteries and actually picks up extra cholesterol and takes it out of our artery walls, and the other forms stick it in. So they're fighting each other, right? The good cholesterol is the HDL. And look, that's largely your genes as well as some lifestyle factors such as exercise, and then can be influenced if you have, for example, diabetes. But for now, that is what it is. There's not drugs we have to sort of boost that up, right? So we really focus, to make it simple, Paula, we focus on the LDL, the bad cholesterol. And then I like to think its little brother called triglycerides, which is the other bad cholesterol. The triglycerides are easy. They're usually not up unless you also have a metabolic problem like diabetes. So it narrows the focus down if you just want to simplify it to LDL, the bad actor, and keeping an eye on that number. I'll give you some numbers because you're asking. If someone's had a heart attack or stroke, we like that LDL to be less than 70, ideally close to 50. That's really low and very hard to get to without medication. Just some people are blessed, but most are not. On the flip side, if you were a 20-year-old healthy male with no other risk factors and no, family history of heart disease, your doctor might not even bring up a cholesterol that's more than double that 140, right? And then there's a huge range in between. And that's where the decision-making comes, either with your primary care or a specialist, such as a cardiologist, nuancing where does your risk lie on that big spectrum and what numbers you should be aiming for, both with lifestyle as well as any, if needed, any medications to get that number to goal.
Yeah, we since we just have a little bit of time left, I was just perusing through some of the questions and if any of our panelists
one of my couple of my former teammates are listening in, and one of them said, Rodney, you always walk like an old cowboy. So that's not true, Chad Lewis.
hilarious. That did make me laugh.
That's funny.
That moment of levity. But there is one little section of one subject I would just like to briefly cover, because I know it's kind of controversial, but it's out there, and it's about COVID and COVID vaccines. We've been hearing a lot about vaccines that are sort of now being potentially recognized as causing heart issues. I don't know if that's proven, but it's definitely something that we're talking about with each other, especially with younger people. Are there any studies, on NFL players? And, what does that look like right now? If anyone wants to address the effectiveness of, or any effects of COVID on the heart, that would be great.
COVID is thought of as by most folks as a lung problem, but in fact, it only starts with the lungs, right? There are features on the surface of the virus that interact very specifically with the arteries and veins in your body, right? So any organ that has arteries and veins, which is all of them, can in some way be impacted by COVID, particularly in the unvaccinated or the people who are behind in vaccinations that keep up with the pandemic. So in terms of risk factors of the vaccine itself, I think the risk of taking the vaccine is far, far outweighed by the benefits that having been vaccinated provide. One of those is reducing the potential complications, either from direct infection by the virus or the overwhelming inflammation that the virus can incite. The virus can cause an inflammatory reaction that can cause a lot of collateral damage, if you will, to key organs, including the heart. So, and last thing I'll say about that, and let other people talk, it's clear that in the wake of the peak of the pandemic, that there are among people who have had the infection, there's a higher rate of issues related to the heart, to clotting and so forth. The percentages are still argued about as we get more and more numbers and get more and more recent data. But it is so critical for people to understand that if they got a vaccination and got the boosters and after that, they did themselves a tremendous favor. And I think they avoided, again, the effects of the direct infection of the virus, and it can go into the cells that line the arteries. It also seems to have a predilection for the plaques, those buildups of cholesterol and junk in the artery that normally are covered over by, call it a membrane. Some of the cells in that plaque seem to be very attractive to the virus. And the reason that's important is that can cause a disruption in that plaque and a cascade of events that could lead to something like a heart attack or a stroke or other problems, including just clotting based on the inflammatory response. I'm giving you a slightly long-winded answer. I just want to be emphatic about the importance of those vaccines and the good that they have done. And side effects have always been at least a small issue with just about any medication or vaccination you can name. So, of course, there will be people reporting side effects, and we should not ignore that. That's important. But again, overwhelmingly, getting the vaccines has been an important thing for the public health.
Thank you so much, Dr. Taylor. We just have a few more minutes left. I want to thank our incredible panel. I know that a huge amount of information has been shared today that is all incredibly valuable. So I wanted to show a couple of resources that the Football Players Health Study has put together that we will be sharing in order to help our participants really absorb this information and be able to reference it later. So as has been discussed throughout this panel, you sort of have an over number and an under number for blood pressure. So we have put together a sort of infographic to help understand what these two numbers are, what is the impact of high blood pressure and hypertension specifically for former players, and what are some things that you can do about it? And this can be accessed on our website, but I will also be sending it out to all registrants. So on the back, we have a little bit more information about sort of where those measures fall as far as high risk to normal, and some specific risk factors to keep an eye out for. So as I said, we'll be sending this around and sharing it because I know this was a lot of information, incredibly valuable, and we did record it, and that will also be sent around. The other resource that we've put together is our checklist called Tackling Personal Health, because we love a football pun here at the Football Players Health Study. And this is a checklist for you to take to any appointment with your primary care physician. We have information if you need help finding a provider, but this will help you maximize your time in your appointment, make sure that you're able to ask the questions that you need to ask, get the tests that you need to access in order to really maximize your time and maximize your health. This is also downloadable on our website, and I'll be sending it around. And finally, there will be a survey coming around after this event. These are really helpful for us in planning our future webinars and different topics and resources that we want to bring to the player community. If you are a former player or a spouse or partner of a former player, or if you're a spouse or partner of a current player, you can join our mailing list to learn more ways to get involved. We do have our FEMFL study, which is for spouses and partners, and then several studies under the Football Players Health Study for former players. And you can follow us on social media at Players Study on all platforms. So with that, I will stop sharing these resources. If our panelists have any last words to say, we have 1 minute left. Any words of wisdom?
I always like to end on a positive. So even though life has happened to all of us and life continues to life, there are things that we can do to make things better. And I think I saw that it was a question from someone that stated, even after incorporating all of these positive lifestyle changes, I am still dealing with blood pressure issues. Then, those are what we call outliers. And maybe there is something else going on that needs to be further investigated between that player and their provider. But scientific studies have shown, and it is proven, that when you incorporate, as Dr. Taylor mentioned, these life essential 8 components, in addition to these other things like chronic pain, addressing the root causes, that it does impact your blood pressure in a positive way. So I do want people to feel encouraged and empowered that they do hold the power in their hands, and they can turn this trajectory so that they can live a fruitful, productive, and a heart healthy life.